Hi, Namaste. I am Dr. N. Manjunatha, working as additional professor of psychiatry at NIMANS, Bangalore. In this video, I will discuss the conceptual clarity on symptoms in medicine as well as in psychiatry. A reality in medicine is that there is no single universally accepted formal definition of symptoms and signs in classical medical literature. However, there is a working definition or operational definitions of symptoms and signs are consistently used in medical practice as well as in medical teaching. In historical medical texts from Hippocrates, Gallen's, Osler's, even how we consider as Harrison principles of internal medicines describe the concepts of symptoms and signs, but not in a strict definitional or philosophical sense. For example, Harrison and Oxford Textbook of Medicine explain symptoms, a subjective experience reported by the patient. A sign is an objective finding observed by the physician, but these are the descriptive in nature, which is not having formal definitions. However, ICD and DSM provides no rigorous definition of these terms, and medical dictionaries like Dorland, Stedman, Mosby's gives circular or overlapping explanations of symptoms and signs. However, the physicians only provide their understanding of symptoms and signs. Hippocrates' modern medicine is based primarily on signs than the symptoms. Often, symptoms and signs are used interchangeably or as synonyms. The origin of symptoms, which use the word symptoms in English, derived from the Greek term symptoma, which means a happening or that which falls together with something. Original Greek terms of symptoma means anything that happens, particularly a mishap. In come to medicine, there is a manifestation of illness is only a short steps. Earliest English definitions of symptoms have a sense of phenomena, or in medicine, which comes circumstances arising from the diseases. Later, by extension, the word included a phenomena which could accompany any sort of processes, not necessarily medical, but something bad or undesirable can happen. So, for example, it is a symptoms of revolt. Here, see, there is no medical term. It's a revolt. Symptoms are used very loosely in many places. Overall, the medical literature gives two operational criteria of the symptoms is self-report and subjective in nature. Self-report means patient must report or complaints. Subjective in nature means something that comes from the patient's own personal experiences or feeling rather than being directly observed or measured by someone else. I feel there should be a third criteria for the symptoms. This is my understanding, which is a spontaneous report, which means patient's complaints volunteered even before being asked or as the first response to opening questions. Why this spontaneous is very important. This spontaneous is distinguishes genuine symptom from the responses elicited by the physician questioning. It reflects the natural expression of distress that motivates people for help-seeking behavior, which should be the essential feature of symptomatology in both medicine and psychiatry. The first responses is always better than the subsequent responses, especially on the questioning. That is why this spontaneous is very, very important. Overall, I feel there should be three essential criteria for the symptoms, which is abbreviated by 3S, means self-report, subjective, and spontaneous. Self-report by the patients only, subjective internal phenomena, spontaneously communicated complaints rather than solely elicited by the direct questioning. This is the third one is my additional criteria for the symptoms. There could be some few questions could arise in our mind that do patients need to report or complaints of symptoms? Yes, it is a must. If patient doesn't report anything, it is not a symptoms. Can anybody other than patient complain the symptoms? No, symptoms can only be reported by patients. This will be dealt in a subsequent video as well also. Do patients reports or complaints of signs? Yes, patient can also report signs and symptoms also. When they complain the signs, they can show the evidence, objective evidences of their problem, especially skin lesions. In modern medicines, signs have a greater diagnostic validity than the symptoms. There are some notions in psychiatry about the symptoms. Psychiatry deals only the symptoms. There are no signs in psychiatry. In other words, psychiatry does not deal signs similar to the medicine. Symptoms and signs are often used interchangeably in psychiatry, though they are not true synonyms. A core reason for this confusion in psychiatry, I feel that because psychiatry is heavily influenced by phenomenology. Phenomenology means what? It is a systematic study and description of subjective experience by the patient, observable behavior by the physicians without interpreting or explaining them. What it means is that what is experience and how it appears is the only important. Nothing why it occurs is not important in phenomenology. But in modern medicine, why it occurs is very, very essential criteria. So, in another way, the phenomenology is a careful description of first person or bottom of their mental experience as they have lived. There is a controversy on phenomena in psychiatry. In fact, the popular American psychiatrist Nancy Anderson, she said in an article in Schizophrenia Bulletin in 2007 that decline is so severe, the phenomenological decline is so severe that it can be referred as a death of the phenomena in the United States. So now I think it is a time for psychiatry to move away purely from phenomenological perspective, especially to integrate into the medicine. Next video will be very interesting, which will be focused on sign. I am sure there will be a brainstorming for especially for the psychiatry. Till then, धन्यवाद.